Okay, hi everyone. Welcome to Sign Ask a Neurologist podcast series. My name is Balpreet Sasan. I am a second year medical student here at New York Medical College. Today I have the pleasure of interviewing Dr. T. Dr. T has a Bachelor's of Art in Neuroscience and graduated from NYMC Medical School in 2018. She completed both her residency in neurology and her fellowship in headache and facial pain at UCLA. And currently, Dr. T is also an assistant professor here at NYMC. Dr. T, thank you so much for joining us today.
Thank you for having me.
Of course. So we're going to jump straight into questions now. So starting off, could you tell us a little bit about yourself and your journey to becoming a physician?
Yes, it's been a long and non-traditional path. So I am originally from Ivory Coast, where I was born and raised, and I went to high school in Tunisia,
Oh.
and then came to the US in college, where I studied neuroscience. I worked in biotechnology for 3 years before I went to medical school.
Mhm.
And then I went to medical school, and the rest is history. I was one of those kids that always knew that I wanted to be a doctor since I was about 10 years old. And I had a beautiful full circle moment last year when I went back and I was, at the end of my fellowship and met my family doctor,
Oh.
who I told him, like, you remember me? I said I was going to be a doctor, and here I am. He's like, yeah, I remember.
Oh, that's so sweet.
So there was this sort of like this cute moment, and so that's kind of my path. So all that to say that it's been a long path, and but I'm happy to be here.
Thank you so much for sharing. So you did mention that you always knew you wanted to be a doctor.
Mhm.
So did you always know that you wanted to be a neurologist specifically?
No, actually, it's funny. I had also a very non-traditional path to neurology. I always thought I was going to be a plastic surgeon.
Oh.
And I went to medicine interested in plastic surgery. And I I was pre-med, always still thinking plastic surgery. And then I studied neuroscience in undergrad, and that's when I started being introduced to the brain, and I thought
Mhm.
it was interesting. And my work in biotechnology was sort of neuroscience adjacent as well. That was sort of when I started considering neurology.
Mhm.
And when I arrived at NYMC, through sort of being exposed to it more and more, I started really thinking more about a medical specialty instead of surgical
Yeah.
specialty. And I realized fairly quickly that I was not the surgeon type. I think that's the first tree of decision when you're looking for what to decide in terms of specialties. Are you going to be a surgeon, or are you going to be a medical non-surgical specialties?
Mhm.
And I don't like waking up early. I The OR doesn't fascinates me, but it's not the environment where I thrive.
Right.
And so I realized those things were not um, as appealing to me as I thought it would be.
Mhm.
And around that time, when I was at MS1, I met Dr. Etienne,
Yes.
who you guys are all familiar with. That was my mentor, became my mentor. So I did research with him at NYMC. He encouraged me to apply to scholarships. There was an AAN minority scholarship where it's all expense paid and you go to the annual conference. So mine was in Vancouver, Canada. So I went in the middle of my second year. It was right before step one, actually. And it really blew my mind. It really opened my mind to the possibilities
Mhm.
of what neurology could be. I went in neurology just not knowing exactly what it was
Mhm.
and what the possibilities were. And I was very surprised to find out that there's at least now up to 20
Mhm.
fellowships. So I realized that there would be anything that I was interested in medicine, I could find it somewhat related to neurology.
Mhm.
There's neuroradiology, there's stroke, there's headache medicine, there's neurotology, there's cognitive behavior. No matter what you're interested in, epilepsy, there is something in neurology that is sort of adjacent. If you like the immune system, there's a neuroimmunology.
Mhm.
Just take almost any specialty, put neuro in front, and it's a fellowship for the most part. And so that conference really, really opened my mind, and I just was like, okay, could really be a viable path for me. And so when I got to third year during rotation, I also really, really liked internal medicine.
Mhm.
So I even thought about doing a dual residency,
Mhm.
internal medicine and neurology.
Mhm.
And credit to Dr. Etienne, he steered me back. He sat me down and asked me, what is it about internal medicine that you love, and I will find it in neurology for you. and um, and then third year just solidified my interest. I just really love my rotation, and then I decided to jump in. And after I had decided, I did multiple ways. I did three,
Oh,
which is not typical for neurology. I did one on the East Coast, one on the West Coast, and then one with Dr. Etienne.
mhm.
And that sort of helped me really get a good perspective of neurology in different
Mhm.
settings and solidify my desire to do it. And I went into residency thinking I was doing to do neuroinfectious disease
Mhm.
because that was sort of the closest to internal medicine I could get in neurology. And I ended up in headache. So I think the lesson here is that you have to keep your mind really open, that your path might change and it's okay. And Funny Fi is my best friend, is a um, she's a neurointensivist, and she was interested in headache and ended up being a neuro ICU attending now.
Mhm.
So, things change very quickly. So you just have to stay open-minded.
Thank you so much for sharing. I think it's very reassuring to hear that, especially as many of us are very early on in our medical career. So it's very reassuring to hear that you can end up where you want to and maybe not where you initially wanted to, but you would still find something that works for you. Thank you for sharing. So moving on to sort of, so you mentioned, you're a headache and facial pain neurologist. So what sorts of conditions do you treat, or what is the most common condition that you treat?
So headache and facial pain is a specialty that is all encompassing of any headache and pain disorder that is neck and up.
Mhm.
And so the most common one that I treat are tension headaches and migraine. About 1 billion people affected by migraine in the world. It's the actually third most disabling neurological condition after stroke and epilepsy. And so there's no shortage of patients that need my help. I also treat more rare headache disorders such as cluster headache, which you might have seen on step one.
Mhm.
And believe it or not, there's about I would say, easily 50 more headache disorders out there. Anything, any disease, any condition can give you a headache.
Mhm.
Any medication almost can give you a headache. So there's definitely, it's a lot more intellectual that people would imagine, and there's definitely an art to it. The facial pain part is covers things like trigeminal neuralgia, which I saw a patient today for. I also take care of people that have had like surgery, so craniotomies, VP shunts,
Mhm.
that now have persistent pains.
Mhm.
So after you cut any nerves around the head, you can have persistent neuropathy or neuralgias.
Mhm.
So I do a fair amount of procedures. The most common procedure I do is Botox for chronic migraine, but I also do nerve blocks. So they fall under peripheral and occipital nerve block. So occipital nerve block is lidocaine and bupivacaine injection of the occipital nerve, and then also any nerve of the head. So that counts for the auriculotemporal nerve, which runs here, the supraorbital nerve, which runs here, supratrochlear nerve that runs here.
Mhm.
And then I train under some pain management specialists. So I've also learned how to do some ultrasound guided procedures of injection of the back for musculoskeletal pain.
Thank you. Thank you for sharing that. And then sort of another question related to your practice. How would you sort of describe your work-life balance currently?
Currently, it's pretty great. I will say that you see the light at the end of the tunnel. It's a long road, but it's worth it. Life as an attending is immensely better than as a trainee.
Hmm.
Now, headache fellowship was very, very nice. So I can't complain. It hasn't been a drastic transition because I already had a very nice lifestyle in
Right.
headache medicine. We don't really have emergencies. We are 100% outpatients. So that was
Mhm.
also very nice. But there's a level of autonomy that comes with being an attending that you don't have as a fellow, and more control on your schedule and the decision you make. With that comes a lot of responsibilities and also pressure to perform, but it's very rewarding, and it's sort of like what you've been training for, what you've
Right.
been waiting for. So it's been great. I typically work a normal 9 to 5,
Hmm.
um, 5 days a week. Usually I have one day a week that is mostly procedures, so
Hmm.
it's a lighter day intellectually. And in this current setting that I am in, I also cover the hospital on a few weekends a year.
Hmm.
Those are, it depends on which weekend you get into.
Hmm.
Some weekends are busier than others, and it's attending only. So when I'm on, I'm the stroke team, I'm the general team, I'm
Right.
everybody.
Hmm.
So it can be very intense. So those week are definitely above 40 hours, but
Hmm.
generally very reasonable, and just really good work-life balance.
That's great to hear. I'm very happy to hear that. And you did touch on this a little bit, but how would you say your work-life balance right now as an attending is compared to residency?
So I think the main thing is one, it depends on the specialty you choose, or
Hmm.
subspecialty. 90% of neurologists ended up subspecializing, so we are very, very specialized as a field.
Hmm.
My best friend, who's a neurointensivist, has a very different schedule than I do. Right, so
Right.
it's 7 on, 7 off,
Right.
but the
Hmm.
7 on is 12 hours, so it's very different, right?
Hmm.
But she's off for 7 days in a
Hmm.
row.
Hmm.
Um, so in residency, you don't really have autonomy on your schedule. The hours are very variable, and there's not a lot of predictability because
Hmm.
every month you change rotations. You're on the stroke team, then you're on the general team, then you're outpatient, inpatient. And so you're not a master of what you want things to look like.
Hmm.
And it's sort of, and inpatient medicine in general is less predictable. So when I walk in every day, I have a list of patient of the day. I know how many patients I'm seeing. I know why they're here. And so I can sort of mentally plan my day. When
Hmm.
you walk in the hospital, whatever comes, comes.
Right. Yeah.
You don't know. It could be a slow day where you have 2 consults, or it could be a busy day where you have 10 consults. So it really depends. And I've definitely had days since I started as an attending when I was inpatient where I saw 20 patients in one day.
Hmm.
So it really depends, but I would say that it's generally much, much better. And when you make a decision, no matter what specialty you choose to go into, look at the life of the attendings. Do
Hmm.
not look at the life of the resident or even the fellows, because it's
Hmm.
not representative of what your life would be. Ask the attendings what their life look like and their responsibilities look like.
Thank you for sharing. Yeah, it sounds like there's a lot of variability depending on which stage of training you are and which subspecialty you're taking on. So that's good to hear and good to know.
Yeah.
Okay, so and moving on to sort of general questions, do you have any advice for aspiring neurologists who may be watching this podcast?
Yes. I will shamelessly plug headache medicine. It's a great specialty. We are very friendly. We are very nice people. It's a very nice mix of inpatient, outpatient, well, mostly outpatient, but procedures and the intellectual side. And the American Headache Society has on their website a lot of resources for people at the pre-med, medical school and resident level that want to get involved.
Mhm.
So that's one way to get exposed to headache medicine specifically.
Mhm.
But stepping back a little bit from that, beyond my shameless plug, I would recommend anybody that is seriously interested in neurology to attend at least once the American Academy of Neurology annual conference, no matter where it is in the country.
Mhm.
I think it's a worthwhile investment in time and also money. And they're pretty generous in giving scholarships, especially if you publish an abstract or if you do any kind of research. It's much easier to have to for NYMC to give you the time off to go,
Right.
even if you, because for me, I was selected, so it
Mhm.
was easier to argue that I needed to go.
Right.
So it's a whole different world, and it will open your networking abilities to and opportunities too. Because I met my future residency program director at that conference,
Mhm.
and so it helps you connect with different people from all walks of life,
Mhm.
and you never know if that person could be an ally
Mhm.
in helping you move further into neurology.
Mhm.
So I would say, yeah. So basically, get involved in the American Headache Society if you're interested in that. Get involved in the American Academy of Neurology,
Mhm.
and also tell people, approach neurologists. We're very friendly. We're not
Mhm.
scary, and we are always willing to help and mentor, and we can sort of guide you in the right direction. If you do a rotation and you don't fall in love during your rotation with the specialty, but you are still interested in the field, shadow somebody else.
Mhm.
Shadow somebody on the weekends. It doesn't have to be a structured rotation. It could be anything you wanted.
Mhm.
You approach a neurologist that is willing to have you, and like before I did my official rotation with Dr. Etienne, I actually shadowed him during
Mhm.
my third year,
Yeah.
where it was just he and I, and we, were on the inpatient side. And then when I did my official rotation as a fourth year as a
Mhm.
sub-I, then I was in the outpatient side. And that was a very different experience than the experience I got during my formal rotation as an MS3. Just because at the time it was a private practice, so it's like a different model, academia versus
Right.
private practice too. So you get exposed to different things. So don't be discouraged if your initial exposure is not enough or not what you expected, or you want to know more. Be proactive in getting more exposure, and mentorship is so
Mhm.
important.
Thank you very much for sharing. I think anyone who hears this advice would find it really helpful. And I think it's perfect timing because I do think there is a conference happening in a couple of weeks. So I
Mm-hmm.
think we'll definitely plug that conference for students if they're interested. Thank you. So moving on to the next question, what do you think are the biggest challenges facing neurologists today?
I think the number one challenge is that there's not enough neurologists. The number of neurologists in the US is about one for every 50,000 people. And so, which is much higher than some countries.
Mhm.
Some countries, for example, where I come from in the continent of Africa,
Yeah.
doesn't some countries don't have a single neurologist,
Mhm.
which is hard to believe. But I think the biggest problem is the shortage. So you will always have job security. So that's one thing. The second thing is the fact that things are moving so fast. With incorporation of AI
Mhm.
and other tools, and being able to integrate that in our clinical practice. In my field, there's a lot of wonderful drugs that you probably starting to learn in medical school now.
Mhm.
The CGRP, the calcitonin gene-related peptide inhibitors,
Mhm.
that have completely revolutionized the field. And some challenges with those are that the new drugs are very
Mhm.
expensive. So one of the barriers that we encounter as neurologists and just physicians in
Mhm.
general is insurance and prior authorization.
Right.
So that's another challenge.
Mhm. And I think there was a perfect segue for this actually, but how do you think the field will change over the next 20 years or over the next few years even?
In a few years, I think the biggest change is that I think AI is going to be incorporated in
Hmm.
every aspect of what we do. We're already using or training AI with machine learning
Hmm.
to recognize strokes and abnormal imaging. It's
Yeah.
not as good as a radiologist,
Right.
but it's getting there.
Wow.
There's AI tools that are being created and perfected to be able to guide non-neurologists
Hmm.
to the most common diagnosis. So I'll use the example of stroke where you have sort of an algorithm
Hmm.
and then the AI asks you some questions and then it's sort of like a tree
Right.
and based on your answers about the patient, they will tell you, well, you need to do this medication
Hmm.
versus that medication.
Wow.
So those kind of tools are being incorporated. And then you have also now the scribes. So now less and less you need a physical scribe.
Hmm.
Now there's tools that listen to you during the visit with your patient and then puts together a note
Hmm.
of what you talked about with the patient and then you edit it. So
Hmm.
it's been slowly incorporated in every aspect of clinical medicine.
Yeah.
I would love for AI to be able to do all the documentation for me, but we haven't gotten there yet.
Maybe one day.
Maybe one
Thank
day.
you for sharing. And one last question for you. Perfect question for you as a neurologist. What is your favorite part of the brain or the central nervous system and why?
That is a tough question. I would say that my favorite part of the brain is probably the frontal lobe.
Hmm.
The reason is because I see the frontal lobe as the mastermind.
Hmm.
It is important for concentration, executive function, um, so concentration, executive function, being able to, behavior as well. And sort of like some aspect of personality as well,
Hmm.
because you see that when people have traumatic brain injuries, they start having personality changes, they're more disinhibited,
Hmm.
and things like that. So it stores a lot of higher cognitive functions that makes you you.
Hmm.
And so that's why I would say it's probably my favorite part of the brain. And it's a part of the brain that is also hard to decipher because it's highly integrated with all of the other areas of the nervous system.
Hmm. Hey, well, thank you for sharing. You answered the tough question really well. And thank you again for joining us today, Dr. T. We hope you have a great rest of your day. Any last minute sort of final thoughts before we end?
Well, thank you for having me. It's been a pleasure. And we neurologists are very approachable. So if you spot a neurologist in the wild, don't be scared. Come and say hi. Well,
Um,
thank you for having
Thank
me.
you. Thank you, Dr. T.